If your child has ADHD or other attention issues, if your child has some other form of neurodiversity that can include giftedness, that can include autism, that can include sensory processing issues, then your child is more vulnerable to anxiety. If your child is very intense, if they are someone who has strong feelings, they are also more vulnerable to anxiety because we all experience anxiety, and those of us at a higher emotional intensity feel that totally developmentally appropriate anxiety more intensely. In other words, anxiety can be present in your child for a lot of reasons. The issue comes when the anxiety starts getting in the way of that child's functioning or the family's functioning or you, the parent, in your functioning. That means if your child is, for example, scared of the dark and shares a room with a sibling, and the sibling can't sleep because the anxious child needs a nightlight, that is getting in the way of family functioning. Does that child have clinical levels of anxiety? Not necessarily, but if they're struggling with how to support the sibling, then you can see whether or not there are clinical levels of anxiety for the child